Presentation about the integration of traditional medicines in public health systems around the world. It started as a project at the United Nations University Institute of Advanced Studies 12 years ago. In the meantime, the World Health Organization has published a new traditional medicine strategy in 2014 for the next 10 years, acknowledging that traditional and complementary medicine, as they like to call it, is an important and often underestimated part of healthcare. It is found all over the world, in every country and in every culture, and the demand for its services is increasing even in countries where Western medicine is prevalent. Even if the traditional medicines are proven in their quality and efficiency and safety, they are often disregarded, and in spite of them being contributing to the goal of providing health care to most of people in the world. So the project at the UNIAS was intended to look at the modalities the traditional medicines are integrated in national health systems. In some countries, they are regarded as on par with Western medicine, and the infrastructure is provided in hospitals. In others, it is only at the grassroots level, but this means that people have access to medicine and health care in respectful, cost-effective, acceptable, and affordable manner. So we had case studies from Japan, Ethiopia, Nepal, Peru, Mongolia, Senegal, Thailand, Sri Lanka, and many other places. Since then, the global strategy, as I said, from the WHO has once again recognized the importance of traditional medicines and has come to accept the importance of the important contribution it has to make to health and well-being of individuals. The WHO is challenging governments of all countries to consider aspects of traditional complementary medicine practices and the practitioners' licensing for integration in their national healthcare systems. The encouraging fact is that the number of countries recognizing traditional medicine has increased, and regarding to herbal medicine, these numbers are even higher. So the goals for the future are to support this people-centered medicine, as it is recognized that traditional medicine are more holistic. They are rather than considering the body parts as in need for repair and replacement. Natural medicines look at the person as a whole in its entirety, including the social economic context. This is the citation from the speech of the Director General, which recognized that safety, efficacy, and proven quality of traditional medicine needs to be more recognized by governments in order to offer accessible, affordable, and culturally acceptable treatment to people. Acupuncture, which originated in China, is now accepted in 103 countries all over the world, as a proven means of treatment. 29 have regulations for providers, and 18 countries even cover insurance for acupuncture treatment. So as I said, the traditional medicines is rooted in the culture of the people, so it takes into consideration not only the illness, but the context in which the people live, in which people work, and where they return after they have been treated. So in the so-called modern developed world, chronic illness is increasing in spite of the progress of Western medicine. So the traditional medicine might shed a light on why this happens. So in regard of looking at the person as a whole, healthcare can be done with less expenses, so putting less burden on the budget, which is very strained in many places. And also the individualization of the person. It's a medicine considering the person as an individual, not as a case number or a statistic figure in a clinical trial. This being said, in Europe, for instance, there are over 100 million people getting traditional medicine and 1/5 of them are regularly preferring traditional medicine to Western medicine. And of course, in Africa, in Asia, in Australia, and North America, there are studies which show that it is not only at the level where there is Western medicine is not available or affordable, but even there where that's why the WHO calls it traditional and complementary medicine, TNCM. So in developed countries, it is a complement to Western medicine because people prefer it to Western medicine. So why do people prefer it? Again, it's not only because it is available and accessible and acceptable, but it is also reflecting the cultural influences, even in countries like Korea or Singapore, where Western medicine is provided, it is still preferred because of the cultural grounds they are based on. The reasons why individuals choose traditional medicine are again the holistic aspect of traditional medicine, the increased awareness of available options, the increased dissatisfaction with existing healthcare services, the focus on quality of life rather than the palliation of symptoms, and the avoidance of adverse effects of Western medicine, of chemical drugs. This being said, that of course not all natural medicines are perfectly safe if they are not done in a proper manner. So this is why regulation is very important, and education. Education of healthcare practitioners is again a subject because in 72 out of 129 member states, so this is more than half of member states, there is absolutely no education at the university level in traditional and complementary medicine. Only 39 countries, that is 1/3 of them, have some level of education at university level in PCM, and 1/3 of them have not answered. So there is still a long time to go to accept traditional medicine and teach it to future medical doctors and health practitioners. At the same time, national research institutes increased again from 19 in 1999 to 73 in 2012, which is a big step, but still there is much to be done. And the regulation of practitioners is gaining also, but there are still more than about half of them have, and half have no regulation, which is the neck point. Traditional medicines are considered of being two kinds: the medicines, the herbal products, or waters, or things to be ingested, and the procedures like massage or stone therapy or external therapies. So depending on the country, these are freely practiced by unlicensed practitioners, or they need to be licensed by government bodies in order to be accepted. There are countries like Mongolia, where the population is very dispersed over a large territory, and the access to former healthcare is very difficult. There are a system of portable medicine boxes based on traditional medicines made in Mongolia was implemented. So there is a medicine box provided by non-governmental organization, and now the government of Mongolia has supported the program, and they use when they need and what they need, and healthcare practitioners come every 6 months and replenish what has been used and collect the money for what has been used. So it's a very practical educational system, which after Mongolia has been implemented. This is a picture from Mongolia, in Vietnam, in Myanmar, in Laos, in Thailand, in several countries, and it is very well accepted. In Japan, which claims one of the longest life expectancies in the world due to lifestyle and medical care, still 84% of Japanese doctors use traditional medicine, Kampo, in their daily practice. But also pharmacists deliver traditional medicine. The National Health Insurance System provides coverage for some medicines and preparations of Kampo. And in future, the availability of traditional medicine through the National Health Insurance System tends to increase. Sri Lanka has a long tradition of Ayurveda, which has been developed based on the Indian philosophy, but given that the island has a particular flora, they have developed their own medicines over the centuries, and it is so ingrained in their culture that there is a Ministry of Indigenous Medicine exactly as it is a Ministry of Health. So there are two ministries in Sri Lanka as well as there are in India. And the National Institute of Traditional Medicine is more than 30 years old. There are hospitals, district hospitals. In Senegal, the tradis praticiens have license. This is proudly shown by the Marabu. The Association for the Promotion of Traditional Medicine in Senegal has also produced drugs which are used for treatment of HIV-infected people based on local herbs. There are clinical studies proving the efficacy of these drugs, which are provided to patients. In Switzerland, which is one of the most developed and base of many pharmaceutical companies in the world, the citizens have the right to choose their laws, and they have voted for 5 traditional medicines, including homeopathy and anthroposophical medicine and phytotherapy and traditional Chinese medicine, to continue to be provided through the national health insurance system. This law has been based on a 5 years long survey showing that the cost effectiveness especially is greater for these medicines than for Western medicine. And of course the acceptance and willingness of people to have it provided was decisive. Again, the World Federation of Hydrotherapy and Climatotherapy is also using climate and mineral waters for drinking and for bathing as therapeutic agents, not only in Europe, where there is a long tradition, but in North Africa, Southeast Asia, and Latin American countries. Ministers of Health recognize hydrotherapy as effective and efficient. However, of course there are challenges because it is difficult to patent natural products, but yeah, and the insurance is difficult to be provided. For instance, in Japan, where there are the most numbers of hot springs, balneology is still very little accepted medical specialty. So again, given these positive examples in the last decade that traditional medicines are more and more recognized by governments and of course people, there is hope that they will be more provided, even covered by insurance in the future. Also based on research done in these research institutes, which are slowly but steadily appearing in many parts of the world. Thank you very much. This is a very brief presentation, and I'm happy to talk more according to your interests and questions. Thank you.
Thank you.
Do we have any questions?
Yeah, even in India, many of my aunts and uncles, they use homeopathic and Ayurvedic, so they say that the side effects, there are no side effects to use those medicines, and that's what they use.
Yeah.
I'm gonna write your last name. So like, wait, yeah.
My cousin's daughter is going to graduate in Ayurvedic. She's going to be an MD in Ayurvedic medicine. Her dad has a big clinic in one of the villages in India, so she might continue taking care. Yeah, so it is very common.
Yes, I mean in India there are hundreds of colleges and
Homeopathic, Ayurvedic,
yeah. The Ayush is Ayurveda, Yoga, Unani, Siddha, and homeopathy are considered as important as Western medicine.
Yeah.
If not more, I would dare to say.
Thank you very much.
You're welcome.
Yeah, Mike. Actually, I do agree with you when you say it's accessible. I think it's also cheaper, and but however, the acceptance aspect of it, for example, coming from Africa, it's really, there is still this contention about traditional medicine as an alternative use to conventional medicine. Why? Because most people who practice traditional medicine, they are either not so educated, but they have the indigenous knowledge, you know, like they have been living with these plants, and so they know how to use it. So most often Western constructs, they say, oh no, the usage is being abusive. So you made a statement on that traditional medicine should be people-centered. How could it be people-centered with this aspect?
Especially in Africa or in parts of the world where education is being done by word of mouth, not in a formal place, it is very important that the formal system acknowledges and understands the concepts of traditional medicine and understands simply what they are doing. If there are two different paradigms and they completely deny each other, or they say, well, this is not good because I don't understand it, and this is not good because I don't understand it because I haven't been educated in that, this is damaging to everyone. What I'm trying to say is that the formal system, which of course is the powerful one, should try to understand and accept and at the same time those who have the traditional knowledge and the informal education should get a little bit educated in, for instance, hygiene or simple things, so that they can compromise and get to a common ground. Otherwise it's exclusive and it's damaging to both sides.
Yeah. So, what is the World Health Organization working towards synergy between traditional practitioners and also those who are in the, let's say, the green sector in terms of pharmacy? So, is there a synergy? Actually, that's what I want to know.
Well, this is another slippery territory, because of course most of the research in medicine is done through medicinal plants, and knowledge comes from there, and there are many contentious issues there too. So it is difficult to get into this discussion now. It is important for the people to accept that, for instance, having a ceremony even when somebody is ill, then the whole village gets together and they have a feast and they have good food and they have rest and they have recognition, and then this gives the sick person a health of being cared for and better chances of recovery in a traditional setting, not necessarily in the hospital in the city.
Well, thank you very much, Mihaela. Thank you. Most informative.
Thank you very much. It is inspiring to talk about medicinal plants and traditional medicine in such an awesome place like the Grand Canyon. Although the people here have a culture which permeates to our days, it is so important to remember that plants are food and medicine for us. And just imagine the trees and their reverse is our respiratory system. We breathe because trees exist. We breathe oxygen and release carbon dioxide, and the plants do the opposite. So this symbiosis is crucial to nature. In our modern world, we often forget that everything is linked to each other. This walk around here reminds us of the connection between rocks and plants and animals, and in the end to us humans, who should have the understanding of respecting everything around us. This is the Utah Juniper, a tree of the coniferous family, like fir tree and pines and junipers. They are all very useful to us, and they have traditional usage from food to bedding to medicine in every culture. And they grow everywhere in the world, and every culture has usage for them in medicine, like respiratory diseases, and the buds they use collected in spring as tonics. Sequoia is one of the most impressive trees, and the buds are fantastic in their power to energize and revitalize. Also on trees there are mosses and fungi which have important usages traditionally and in modern medicine. Most antibiotics are made from fungi. The aloe plant is one of the most useful also through its many properties regarding cicatrization and helping the skin regenerate and giving treatment of burns. It is a wealth of properties and usages and pharmacological experimentation done over the centuries and millennia by people all over the world.
And is that knowledge open to everybody, or only traditional healers have that knowledge now?
I think most of it is open, and that is not open and it's not known, so we don't know it. But a lot is known and still not used. Even if it is known to a limited community, or to people who have not lost the connection to their environment.
And what do we do when one tribe says this is a particular medicine of their tribe and they claim intellectual property rights, and another tribe in the other part of the world also uses the same species? How would we find an appropriate method for benefit sharing for competing claims of different peoples over the same plant?
What are the claims? I mean, people in this area use their trees, and it's their knowledge and their responsibility to harvest them so that they don't get.
But when, for example, for extraction of active pharmacological elements,
it's totally different. Traditional medicine doesn't work on active principles extracted and isolated. It works holistically. It's a total extract of the total tree. And if it is the bark or the leaf or the flower or the fruit or the root or whatever it is used, it is not in traditional knowledge sense. It is not because it has this and this and this compound, because ancient people didn't know the biochemistry of it. But it is by empiric experience that they found out how they can be used.
well, for example, they did know that at certain seasons they should be harvested and other seasons they should not. Yes. So that's some biochemical understanding, yeah?
Yeah, of course.
Can you give us some examples of that?
Of course, they noticed that from the same tree they can make tea out of the flowers of the tree, or they can preserve the buds and have an extract which is more potent. So there are stem cells. If we talk in modern language now, it's the buds contain the pluripotent stem cells from which the entire plant can be developed, can develop. And it's much more effective to collect buds in spring rather than the flowers in summer. And this is knowledge which can be applied in modern pharmacology as well, a branch of gemotherapy. But what you said, that people in different parts of the world have claims for it only refers to patenting, I suppose, and these are natural products in their entirety made which are not patentable. So the knowledge, I'm not sure. I mean, this is a legal branch which I'm not an expert in. If they claim, well, we know this and we know the same thing, I only can say I'm very happy to find out that people from different regions have the same understanding, because that means that it really works. It's not only an imagination and a tradition, superstition, whatever. It's evidence-based, not necessarily on a large cohort of people in hospitals, but on large cohort of people in various geographical regions and along many, many, many years of experimentation and trial and errors. The sagebrush, one of the holiest plants for Native Americans and for many other cultures. Its scientific, the family name is Artemisia, and Artemisia comes from Artemis, the Greek goddess, and so it's used in female pathology and cleansing, and it's very used in the Native Americans made it in steam baths and of course teas and body washes. And you notice
it smells like paste, like like
Toothpaste.
Yeah.
Yes.
It also
to the-
smells like mint. It
Yes.
has a mint smell, and but I can't understand how it's used for cleansing during ceremonies.
Yeah, because you can burn it, and so the smoke is purifying for the lungs, and you can put it in water and boil the water and have the water have disinfectant properties. It can cleanse physically and then get rid of bacteria. It's as you said, it's a relative of oregano and basil and these spices which we use in cooking. Sage also is used in cooking.
Okay. So you just need to boil it in water and drink like normal tea?
Yes, we can do that.
Wow.
Yeah, but you can also make the moxibustion, like you grind it and
Like paste?
no, make powder and then boil it, burn it, and the fume, the smoke purifies.
Wow. Interesting. Thank you very much.
Yeah.
And you've seen it across the world in different continents?
Yes, it's in Europe also, in Asia also. I don't know about Africa.
I don't know. I've not seen it
Yeah.
also in Africa, so I was wondering because I don't know about it. My first time.
That's interesting.
Yeah.
In Europe it's quite common, and in Asia also. There are many species.